right hip extension. Good. Okay, so I'm gonna do this. I'm gonna bring his leg up, and I'm gonna have him push against my hand as hard as you can. Do you see how he's flexing? You see that? Okay, and try not to substitute, try to just sit. Okay, let's do it again. Push down. You see that?
Yes.
Okay, good. If I resist, if I want him to extend for some reason, okay, I'm gonna resist right hip flexion. Okay, ready? Now bring the leg against my hand. Can you feel? Pushing down on the other leg?
Yeah.
Okay. Okay, let's try it. Let's try to get some knee flexion on the left. What am I going to do? Resist extension on the right. Okay, let me see if I can get in a good position. It's going to be against gravity, but okay. So, push out against my hand. Do you feel anything coming? Do you feel like your legs going down or no?
No.
Yeah, it might. It's, yeah. Everything. Yeah, it doesn't all work. No, and that's why you try a lot of different things, because sometimes it doesn't work for people. Okay, let me see. Can you go into kind of a flexor synergy a little bit? Okay, let's see. So I want, in the left upper extremity, what am I trying to work on? Extension. So what am I going to do?
Extension.
I'm going to flex the right elbow, okay? So if I have you flex against my resistant, oh no, I'm sorry.
Extension,
sorry.
yeah.
So if I have you extend, can you see? A little bit. Okay, don't hold it so tight.
Well, he's purposely.
Yeah, he's purposely pulling back, but okay, try to do it again.
Yeah, I saw that. The first few seconds.
You see how it's coming out?
If you don't have as much control, then it's gonna.
Yeah. So it's overflow. I like to use elevation of the shoulder. So what I'll do is I'll get behind him and I'll resist right shoulder elevation to get left shoulder elevation, and then I might even tap at the same time.
Oh, the
Okay?
The root technique?
Yeah. Okay, so shrug your shoulder. Come on, shrug. Come on, go. You can see he's coming up a little bit, right?
It's like compensation.
It's really a overflow to the other side. I'm not allowing him to move, or I'm resisting his movement, and he's getting some overflow to the other side. So let's see if I just do this, okay? Up against my arm. Go.
Yeah, it's
You
coming
see how
up.
he's coming up a
Yeah,
little
yeah,
bit?
it's coming up. Yeah.
Okay. Again, some people it works, some people it doesn't work. Can you lay on your back? Just kick your shoes off if you don't mind.
Of course.
Shoes under the mat.
Wait, look at me.
Okay, so let's see if I can do a little bit of hip extension in this position and see if I can get some hip flexion. Okay, push down into my shoulder, push.
Yeah,
Push.
right away. Legs coming up.
Nice. Okay, good. Okay, then remise, right?
Yeah.
So I'm gonna resist hip abduction and see if he gets abduction on the left, right? Push against my hand, push.
Right away.
Push, since gravity eliminated, so it's
Yeah,
great, right? Okay. Yeah, I'm gonna bring you out into abduction. Bring your leg in. Come on, pull. Pull. Remise works really well.
Yeah.
Okay. Now, we can use something like a powder board. And a lot of the clinics have this. They might have it in their closet, but take it out. Okay. And I like to put it under the extremity if I want to get, you know, and it's called powder board because you usually put baby powder on it.
Oh.
So you eliminate the
Oh,
friction.
yeah. Right.
Huh? Yeah. So let's try release again. Or let's do this one because you want to usually facilitate abduction. So it really knocks out the friction. Okay?
Got it.
So, thank you very much. Let's see if we can do anything else. Yes.
Sorry, you said earlier, so you prefer to do these all in gravity eliminated, even if it's upper body too, right?
Try.
So
Yeah,
even
because
for
it's
some
gonna
of
be
those, you
more
might have them laying
successful.
down and doing the-
Yeah, it'll be more successful. Let's try some shoulder abduction. So can you push out against my hand? A little bit, not much. Okay, bring your arm up a little bit. Just kind of try to relax it and push against my hand. Yeah, not working that well, but you know, try.
Maybe it's Dennis.
Yeah, maybe it's not.
Yeah.
No, I mean, it just, you know, some people it works, and some people it doesn't. So
Yeah.
that's why you got all those things, right? To figure to use.
Yeah.
Now, homolateral limb synkinesis. What do you think that is?
Upper extremity, lower
Yeah.
extremity, same thing.
Yes. Upper extremity, lower extremity doing the same thing. Okay? So, if you have someone that has a middle cerebral artery, okay, their upper extremity is affected more than the lower extremity, right?
Yes. Yes.
Lower extremity is intact. So what you want to do is, if you have an upper or lower extremity that's intact, and this probably works the worst of all of them, you resist an action on the lower extremity, and you get the same action on that same side of the upper extremity. Okay? So for instance, if I wanted to facilitate elbow extension of the right upper extremity, that's his affected side now, I could try to resist right hip extension. Okay? So let's try it. I don't know, see if you can feel it.
Probably in sideline.
So if you push into my shoulder,
Oh, into the gravity. Yeah.
do you feel anything on that right upper extremity? Not really, right? Okay. I probably use this one the least, but you know, give it a shot, right? You can't use it when both upper extremity and lower extremity are affected, right? You can only use it if either the upper extremity or the lower extremity is affected, okay? And it's same side, same action. Yes.
Is there any reason why it was the hip that you were choosing to resist when it's elbow? Because I thought it would be more like the knee for the elbow than like the hip for the shoulder or something like that.
I kind of go for the big muscles,
Oh, okay.
you know, because you
Yeah.
just have more luck if you do
Makes
big muscle
sense.
groups.
Gotcha.
Doesn't really, none of these really work with the ankles. For some reason, it's like hip and knee. You could try it. I mean, you could give it a shot.
Okay.
I mean, I'm always like, give it a shot. Give it a try. I don't know. Right?
Get enough of those.
Stokes phenomena. I'm just going to skip Rowing for a second because he's in the position. What you can do is you can use something called a Marie Foy. Stokes and Marie Foy are separate. Marie Foy is a reflex where you forcefully flex the toe and the lower extremity flexes. Again, doesn't always work. You have to do it on bare skin. But if I forcefully flex, you feel any
Yeah.
desire to flex?
the knee?
Yeah.
Yeah.
Yeah?
Yeah.
Okay. So that's a Marie Foy. A Stokes phenomena is, say that you have a hand like this, right? That's in full synergy.
Yeah.
and I want to get a splint on, and instead of doing like this, okay, if you can work on the shoulder, rotate it a little bit, get your hand up above 90 and extend the wrist, the fingers will open.
Wow.
Is it also it's externally rotated?
It's usually shoulder flexion, external rotation, extend the wrist, and the fingers come open.
Oh.
And you know, I've had students come back to me like so excited. Oh my gosh, I did so good, it worked, and my therapist didn't even know about it. Yeah, they're just like crazy. So, you know, again, these are reflexes. Sometimes they work, sometimes they don't. My all-time favorite is rowing. Okay, can you sit up for me? And what I do is, and I like to be on something that's not moving. I don't like to do this on a moving. You can put your shoes on. Let me just wash my hands. And rowing is great because you can use it for passive range of motion, you can use it for active range of motion, you can use it for resistive range of motion, and you can use it for active assistive range of motion. Okay? So what I'm going to do is I'm going to sit in front of my patient on something that doesn't move. Okay? I'm going to support his legs if I need to. So I know I have him, so if I tip him a little bit, he's not going to fall over on me. I'm going to cross my hands, and we're going to row. Okay? Now, if it's active, I'll just say, take me with you. Good. If it's passive, I'll say, relax, let me take you. If it's active assistive, I'll say,
Let's do it.
let's do it together. Good. Now, I can do resistive, okay? And I can do associated reactions. So if I want to promote left upper extremity elbow extension, what am I going to resist on the right? Right elbow extension. So I'm going to, I don't want him to pull into synergy. So I'm going to say, let me take you, relax, good. Okay, now push me. Come on, push me away. Push, 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 push. I'm using your abdominals. Okay, and let me take you. And push with this hand. Push. Come on, push. And I'll try to get him out. Right? On the left.
Yeah.
And relax. I don't want him to pull into flexion. Okay, good. And push. Come on, push hard. Push.
Oh,
Push.
nice.
Push. Good. Or if I can just simply, if I'm trying to promote strength, pull me. Come on, pull me. Pull and push me. Come on, push. Good. And pull me. And push me. Okay, so you can use it as resistance.
Wow.
Okay? If I want to work on balance at the same time, I can do this. Okay, good. Excellent. Okay, but rowing, thank you. Rowing is one of those things that's wonderful. You can use it for anything. Okay? You can use it for balance, strengthening, range of motion, associated reactions, whatever you want. Okay? PNF we're going to learn later, but those are the diagonals. Okay? Really terrific for someone who has hemiparesis because you can get them to use their trunk and look, and you can incorporate balance. Postural control. Okay, again, I can have them hold on with both hands. Good. And don't let me push you. That's your instruction. Good. Don't let me push you. Good. Don't let me push you. Don't let me push you. Again, I like it because I have control. Okay? Put your hands in your lap. Don't let me push you. Don't let me push you. Don't let me push you. Good. Okay? Coordination, a million things, right? Do this. Good. Put your hands out. Bring them towards your nose and out. Really good for patients with ataxia, right? Faster is easier. Slower is harder. Slower is harder.
That.
Okay, can have them reaching again. We're gonna balance at the same time, right? I got him.
Nice.
Feel secure.
Mm-hmm.
Little bit of equilibrium, little bit of writing reactions, right? Rude, a lot of times I'll use combinations, right? I'll use, you know, like I was doing before, I was doing the associated reaction and I was not. Okay? You know, I can use approximation. Approximation is approximating the joint, bringing the two surfaces of the joint together, facilitates extension. Okay, lean to the side, lean, 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 good. Approximate, weight bear, tap. Yes.
When you're doing rude, are you doing it in the agonist and the antagonist?
I'm doing it on the muscle that I want to contract. Because I'm saying, come on, work, 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 work.
Okay.
So now I'm tapping the extensor surface.
Based on the muscle you want to control.
Correct. Traction is another thing you can do if you want to facilitate flexion. Because when you pull out, the patient has a tendency to flex. I wouldn't ever do that with someone who has a flaccid upper extremity. Okay? But if you want to get them to flex their upper extremity, you can use traction. Approximation stimulates extension. Traction facilitates flexion. Yeah. Again, you know, ambulation, any kind of interactive games, biofeedback, mirror, repetition, of course, with the motor learning, over and over and over again. Okay, lots of gait training, lots of cueing, lots of, come on, you know, that kind of thing. Lots and lots of stuff to do with someone with a CVA, depending on what they have, right, or what they don't have. Maximize what they got. See what they got, maximize it. They only have one side, develop that one side. What else? Any questions? I think that's it. Anything else? Questions?
Kessler, is that from Kessler
That's
in
right,
relation
yes.
to?
That's right. Martin and Kessler. Martin and Kessler.
Kessler Institute.
I think so. It's a good question. I don't know.
So if they have tendinosis, you want them to facilitate that, right? Because it actually helps them with function.
Yeah.
Tenosins.
Yeah, yeah. Because that helps with getting their hand open, right?
Right.
Yeah, because it's almost like that's what it is. It's, you know, you're facilitating that reaction, right? To get the hand up and out. And the fingers over.
Is there any movement that would help with helping for dorsiflexion?
You know, I would say for dorsiflexion, I would probably work a lot initially in sideline and maybe even on the powder board, trying to get them to, you know, get some dorsiflexion. I would do a lot of tapping, right? You okay?
Yeah, just stretching.
Do a lot of tapping. I would have them, you know, sit at the edge of the bed and do this kind of thing, right? Toe taps. Yeah, dorsiflexion is a little bit tough, but I would probably restart initially in sideline, because then at least I'm knocking out gravity. And have them do, you know, something on the powder board where they're, you know, moving, you know, see if you can knock out some of the medial friction. But lots of tapping, lots of movement, lots of, you know, you bring the foot into dorsiflexion 25 times, and have them bring it into dorsiflexion 25 times, then see if it improves. Once you get the motion, then you can do the strengthening, right? First you want to get that active motion first, then you can strengthen it, then maybe go to against gravity. Yes?
These associated reactions, is this mainly for patients without a CVA, or are there other conditions?
As long as, you know, you can use it with other people, but it seems to work well with patients with CVA. You just have to have a strong side to resist. Like you can't have weak, like you can't do it on a patient with spinal cord injury, right? With bilateral and mouth.
Right.
Can't do it on someone who had, I mean, you don't usually use it with someone with ataxia or something like that. But if you have a strong side, you want to get overflow to the other side, then you can use it.
But it's really all
Yeah. I mean, one side's effective, one side's not.
right.
Yeah.
But not like you said, it's not very effective.
Oh, the homolateral limb synkinesis?
Yeah.
I don't know, I never saw it really work well. You can try it. Always worth a try. But, you know, some of these things, unfortunately, the PTs don't do anymore because they don't have the time.
Right.
Like, they'll just go right into, okay, let's go to the parallel bars and stand up and walk.
That's the problem.
But if you want to show someone, like, I like associated reactions because they need a little boost, you know, and saying, oh, my arm, I can't straighten it, and then you do an associated reaction, and then they're straightening it, and they're like, wow, this is so cool. You know, kind of gives them a little boost, and if you know, you do it enough times, maybe it will, you know, help those reconnections a little bit. But, you know, I mean, I guess that's why I like home care so much. It's because I can.
You got more time.
I got more time, yeah. And I can, you know, go to their bedroom and work with them on the bed and do all kinds of like Mac program stuff with them first.
It's usually an hour.
I mean, it depends on the agency. Usually get paid for 40 minutes,
Oh,
you know,
so
but
it's similar to the hospital.
yeah.